Daniels.
And I'm Jasmine Salary,
And we're doing our presentation on Hidradenitis Suppurativa.
also known as HS.
HS is a chronic and often misunderstood inflammatory skin condition. This disorder significantly impacts patients' quality of life. And we chose this topic because myself and many of our friends are affected from this disorder. We will cover the etiology, pathophysiology, clinical features, diagnostics, treatments, and discuss implications for nursing practice.
HS is a chronic relapsing condition that affects areas with apocrine sweat glands like underarms, groin, and under the breast. It's often misdiagnosed or overlooked, leading to years of delayed treatment. Beyond physical symptoms, HS causes major psychosocial distress, including isolation, embarrassment, and depression.
Etiology. The exact cause isn't fully understood, but HS is considered multifactorial. Key contributions include follicular occlusion, an overactive immune response, and genetic predisposition. About 30 to 40% of patients report a family history. Risk factors include obesity, smoking, hormonal imbalance, and metabolic syndrome. It's important to note that while lifestyle contributes, this is not a hygiene issue. Some patients often wrongly blame themselves for it.
Pathophysiology. HS begins when hair follicles become blocked, leading to rupture under the skin. The rupture triggers the immune system, creating a cascade of inflammation. Cytokines like TNF-alpha and interleukins drive the chronic inflammation. Over time, this results in abscesses, sinus tract formation, and scarring. HS severity is staged using the Hurley system. Stage 1, isolated nodules. Stage 2, recurrent abscesses with scarring. And stage 3, extensive interconnected tracts.
Clinical manifestations. Patients often present with painful, deep nodules or abscesses in the flexural areas. These lesions may rupture and drain foul-smelling pus, causing embarrassment. Chronic disease leads to sinus tracts, fibrotic scarring, and disfigurement. HS is associated with other conditions like metabolic syndrome, inflammatory bowel disease, and depression. Pain and odor significantly impact daily functioning, mobility, and mental health.
Diagnostics. HS is primarily a clinical diagnosis. There's no specific blood test. Diagnostic criteria include typical lesions, typical location, and reoccurrence over at least 6 months. Imaging, such as ultrasound or MRI, can be used to map sinus tracts or differentiate from other infections. Labs may be used to rule out bacterial infections, tuberculosis, or malignancy. Many patients face years of misdiagnosis, often being treated repeatedly for boils before the correct diagnosis is made.
Treatment. Treatment must be individualized, depending on severity. Lifestyle changes, like weight loss and smoking cessation, are the first-line recommendations. Topical clindamycin is effective for mild disease. Oral antibiotics, such as tetracyclines and clindamycin rifampin combinations, are used for moderate disease. For severe or refractory HS, biologics like Humira are FDA approved. Surgical options include incision and drainage, de-roofing of sinus tracts, or wide excision. Equally important, pain management, and mental health support.
Case study. So this case involves a 38-week pregnant woman who came to the ER with pain and a burning sensation under her armpits. Upon assessment, the nurse palpated small tender nodules, and the provider recognized these as consistent with HS. The patient had several known risk factors: female gender, African American ethnicity, being overweight, and a state of elevated hormonal activity due to pregnancy. Pregnancy often worsens HS symptoms because of hormonal fluctuations, particularly increased levels of progesterone and androgens that can influence follicular occlusion and inflammation. Since her case was mild, the physician prescribed clindamycin 1% topical, which is an evidence-based and pregnancy-safe first-line treatment for mild HS. She was advised to follow up with her provider.
At this time, we will present an interview with a friend that we know who has stage 4 HS. Per her request, she will remain completely anonymous. We will reenact the interview, and some names and details have been changed to protect her privacy. Welcome back. Today, we're going to have an honest conversation about health, resilience, and the stories that shape us. We're talking about a condition that so many people suffer through in silence: hidradenitis suppurativa, also known as HS. And we're honored to have our friend Rebecca here, courageously sharing her story. Rebecca, thank you so much for being here today. We just want to hear your story.
Thank you for having me. I'm honestly excited to talk about this because for so long I felt really alone. Maybe somebody listening will hear something that helps them feel less isolated. So, I have stage 4 HS, and if you're familiar with HS, you already know that means constant pain, deep lesions, drainage, infection, and flare ups that can shut your whole life down. There were days when I literally could not lift my arms, days when walking felt like fire, days when I couldn't sit comfortably, couldn't sleep, couldn't hug my kids the way I wanted to. HS doesn't just hurt physically, it hurts emotionally, mentally, and spiritually.
Yeah, I get that. I really do. And I know that this went as far as you losing your job. Can you give us some more details about how that happened?
Yeah, so at one point, the flare ups got so bad that I lost my job. I worked in a position that required lifting, moving, and staying active, and I couldn't do it anymore. Every time I tried to push myself, the inflammation would flare, the lesions would tear, and I would end up in even more pain. And listen, losing that job shook me, not just financially, but mentally. I felt ashamed. I felt like my body had failed me. I battled depression. I didn't want to talk about it because people don't understand that HS is real. It's not just bumps, it's a disease that affects your whole life. But losing that job forced me to slow down. It made me take my health seriously and it pushed me toward a better path.
Yeah. So you were talking about pain and emotions. Can you delve into the pain and the emotional burden that comes with having HS?
Yeah, there were times when the pain made me cry, like a deep from the soul crying. HS pain is different. It's pressure, burning, stabbing, throbbing, all at the same time. And mentally, whew, when you can't move certain ways, when you're scared of the next flare, when you worry about odor or infection, it does something to your confidence. My anxiety was sky high. My self esteem dropped. I didn't even feel like myself anymore. But I finally got into a treatment plan that worked for me.
Okay, so when you got into treatment, can you help us understand like what the treatment was or if you had to make any lifestyle modifications?
Yeah, so my dermatologist started me on a consistent treatment. It didn't fix everything overnight, but it began to give me some relief, enough to breathe again. Then I started learning about lifestyle triggers. And let me tell you, HS will teach you fast that inflammation is the enemy. Changing my diet was huge. When I started eating anti inflammatory foods, less dairy, less sugar, more greens, more whole foods, less processed stuff, my flares went down like dramatically. And when I'm eating right, I can literally feel my body thanking me. Stress was another big trigger. Anytime my stress spiked, boom, another flare. So I had to start protecting my peace. I do deep breathing, journaling, stretching, and just taking quiet moments for myself. And weight management also helped my body not rub as much in those HS prone areas. Even losing a little bit decreased friction and flare ups. All of these changes together, it didn't cure HS, but they helped me live again. They gave me a sense of control. They cut the flare ups way down, and that gave me some hope.
Wow, that's great. Can you maybe tell us like where are you now?
Now, so treatment is going well. I still have HS. I'll always have HS, but it doesn't control me the way it used to. I'm able to move around more. I'm able to sleep better. I'm able to enjoy my family without constantly fighting pain. And emotionally, I feel stronger. I feel more like myself. And the biggest thing is, I'm kinder to myself now. I give myself grace and celebrate everything my body pushes through. HS taught me to love myself deeper, even in the struggle.
So, if you had to give a message to other people with HS, what would it be?
Um, if you're listening and you have HS, please know you are not dirty, you're not lazy, and you're not alone. Your pain is real, your experience is valid, and you deserve care, love, support, and healing. The biggest lesson I learned is this: be patient with yourself, listen to your body, and don't let anyone make you feel ashamed of something you didn't ask for. I'm healing slowly, but I'm healing, and so can you.
Thank you so much, Rebecca, for opening your heart today. Your story is powerful, and I know it's going to help someone listening understand HS on a deeper level. To anyone dealing with chronic illness, remember you deserve compassion, treatment, and community. We thank you so much for listening, and we'll see you next time. Significance of HS. HS affects about 1 to 4% of the population, though it's likely underreported. Onset typically occurs after puberty, often in the 20s and 30s. Women are more frequently affected than men. Consequences are significant: chronic pain, social stigma, impaired mobility, and high rates of depression and anxiety. HS also results in high healthcare costs due to repeated hospital visits, surgeries, and medications.
Prevention and management. True prevention is limited because of genetic and immune components. The best strategies are early detection and risk reduction, smoking cessation, weight control, and stress management. Hygiene is important, but does not prevent HS. It's critical to educate patients so they don't blame themselves. Long-term management requires a multidisciplinary approach: dermatology, surgery, primary care, mental health, and nutrition.
Cultural and holistic considerations. HS carries stigma, leading many patients to delay seeking care. Cultural beliefs about skin conditions may influence treatment acceptance. Studies show African American patients often present with more severe disease and face greater healthcare disparities. Holistic approaches include nutritional counseling, support groups, and mental health care. Patient education must be culturally sensitive and individualized.
Impacts on future practice. As future APRNs, we must be vigilant in recognizing HS early. Education and advocacy are key. Patients often feel dismissed or unheard. Using evidence-based guidelines ensures patients receive appropriate care, including advanced options like biologics. We must also treat the whole person, addressing pain, mental health, and lifestyle. Ultimately, APRNs can help reduce stigma and improve long-term outcomes for HS patients.
In conclusion, hidradenitis suppurativa is a chronic, painful, and often overlooked disease. It requires early recognition, evidence-based treatment, and holistic management. APRNs have a critical role in improving outcomes and supporting patients both physically and emotionally. Thank you for your attention. I'm Felicia Daniels.
And I'm Jasmine Salary.